Weiner from the Aesthetic Clinique, and what we're going to demonstrate today is Sculptra injection. We're using one vial to fill the temples, the area around the eye, and the marionette area. She's already been cleaned with HIPAA, so I consider this a very sterile procedure. We use cooling as a way to help minimize the discomfort. And Sculptra is great for volumizing all areas of the face. It's a long-lasting filler that lasts 2 years or longer. So we'll start over here with injecting in the temples. And what we do is we go down to the bone and we check for any reflux, and we inject very slowly. And this is a technique that I teach to other doctors. I'm a physician trainer for Sculptra, a very large user of Sculptra. And it's very easy to inject temples. I think the best injection to improve the temple deficit is with Sculptra. And you can see that it goes fairly quickly. And basically we're done. So that rounds out the upper face. And you can see there's minimal bleeding over here. Minimal discomfort associated with that. And her temple is now more rounded. So we'll take a quick break and go to the eye area. So we're back, and since you've been gone, I improved the other temple. And right now she's already cooled this area, so I'm gonna improve the area around the eye, and I'm going to do it from two different approaches. I use a cannula for this, which I find is a lot safer, more comfortable, less bruising, less swelling afterward. So that's a vibration, and then I vibrate the skin a little bit to make my entry hole here. And then I take the cannula, which is a 23 gauge Dermasculpt 50 millimeter, and I'm going right here where the infraorbital nerve is, giving a little block right there, going up to the tear trough area, and a little bit in the medial cheek, right here. And I'll come around and I'll give a little bit to the lateral cheek, right over here. And I make sure that I do some of the lateral orbit as well. And I'm up over here. You got to get that lateral orbit too. Okay, so that's the one attack for the eye. And then I'm going to go horizontally as well. And so I'm going to make another small pilot incision right here. And then I very carefully go underneath the orbital rim. And I can do this trauma-free. Now I'm right over here. And I just give a little bit of Sculptra. Probably about half a cc max. And there I'm done. So I've done the infraorbital area, the tear trough area, lateral orbit, lateral cheek, medial cheek, all with the cannula. Okay, so pause please. So this is the third part of our injection. We're going to go down into the marionette area, right in here. Again, I use a cannula for that as well. I have a little bit left. And so I like to vibrate the skin a little bit, and that distracts. And then I go into the area and I just spread it all throughout this area very, very quickly. There we go. So basically we're done with the injection. She's pretty well, volumized, so we didn't have to do a lot on her. So we did the upper cheek, medial cheek, tear trough, under eyes, we did the temples, and we did the marionette area. So Sculptra is going to kick in approximately 6 weeks. You'll see the result from the collagen that it stimulates, and that result should last you 2 years or longer. It's a great filler. And then if you have a little fine tuning you need to do after you're done, and the Sculptra is complete with its collagen stimulation, you can do a little hyaluronic acid like Restylane on top of it to do the fine tuning. But Sculptra is basically a great base for extreme volumization. A vial of Sculptra is equal to approximately 4 syringes of Restylane, Perlane, Juvederm, Voluma. So you can get a lot more oomph for your injection with Sculptra versus those other HAs. So if you want to learn more, give us a call or look at my website, theclinique.net. Thank you.